Now we have, this was a very nice and first experience, I think, both the complexity and the challenge. Now we have 7 few, let's say, sharing of experiences that can go both in the positive or the negative side or balance. It's all up to them. We start, let's say, within the program and then gradually we go out. First is Inge Brouwers, leading the flagship food systems within this program of H4H, and she's associate professor in nutrition at Wageningen University. 3 minutes, no more.
My 3 minutes of fame.
Yes.
So I would like to share with you some of the challenges we faced in implementing the Amsterdam Initiative Against Malnutrition, which is a collaboration, we call it within the Dutch Diamond, with the private sector, government, civil society and knowledge institutes. Underfunding of the Dutch government, several projects were implemented. So some of the challenges that we faced at the beginning was a really difference in language. So we talk about impacts, IDOs, milestones, theories of change, reach of vulnerable groups, but the private business was talking about business case, return on investments, value proposition and market strategies. So it took quite some time to get closer to each other. A second point is that there were different approaches and expectations. So the private sector starts from the assumption that the problem can and will be solved, while we actually thought we had a solution to the problem, but we still wanted to seek evidence for that. And the private sector seemed to be very sensitive to engage in activities that have a high risk of neutral or negative impact. The third point was the absence actually of a clear business case. So we started to talk to them very much at the beginning of the project on what could we do. And they were very much looking at what is actually our business case here. They wanted to have clarity on return on their investments. And as a last point is the government had really very complex administrative procedures. And actually 2 of our private partners stepped out because they said that progress is just too slow. And the structure in private sector is actually going quick. It's a structure procedure with go and no-go stages. And when they say go, it will happen anyway. And in the Dutch government and the scientific partners, it's not always like that. So we concluded that we need robust criteria for the private sector. As I said earlier already, they are very diverse, not only small, medium and large, but you also have family-owned businesses that have a typical different way of working. We should come up with compelling business cases and value propositions to help private sector. There should be real clear roles and responsibilities. Risk mitigation, and as the last one, there should be a clear exit strategy for private sector.
Thanks very much, Inge. Now the second one is Victor Manyong. He's in the very back. I will go to you. Victor is agricultural economist with IITA in Nigeria and also has a very interesting experience to exchange.
Thank you very much. My experience I want to share with you is about a product called IFPRI. IFPRI is a new product against aflatoxin. And aflatoxin, you know, creates health problems to the consumer, but also it affects trade in the international market. The problem that this issue is invisible to the eye of the consumer. Now, what is the business model that can be used to promote this product? It is a public health issue, but it is also a trade issue. As a trade issue, it is a problem that is very sensitive to the private sector, because when they want to export their product, groundnut or maize, then the product cannot go through to the international market. But it is a public health issue because it affects commodities that are major staples, like maize, in many African countries. But it is not visible to the eyes of the consumer. So they are not aware of that problem. So the few people who are aware of the problem is the government, or the research and the scientists, or the private sector that is interested in trade. Now the issue is, what will be the best business model to promote this product? As a trade issue, the private sector will be interested, and indeed, we see the private sector like Nestle, Mars, very much interested in this issue. But as a public health issue, it is very difficult to convince every consumer that you should not take on that product because it has health issues. It's only the public sector probably that can initiate the process. So the problem for us is what will be the best business model. Public partnership, public partnership. That is the issue we are addressing. Thank you.
Thank you. So you may applaud if you agree. The third one is really from private. We always talk about private sector and then there is nobody for private sector. Now private sector. Scope, Director, Health and Nutrition Policy from the Grocery Manufacturing.
So the Grocery Manufacturers Association represents leading food and beverage manufacturers in the U.S. It has done so for 100 years. Our members have done a lot of work putting forth affordable, nutritious, convenience, and accessible foods and personal care and household products, and have a commitment to innovation and transparency in meeting consumers' needs to lead healthy and active lifestyles. To support this commitment, our members have made some significant investments in activities such as enhancing labeling and nutrition education and information, which I'd like to talk a little bit more about today. In 2011, along with retail partners from the Food Marketing Institute, manufacturers voluntarily created a simplified front-of-pack label that gave consumers at point of purchase on the front of their package information about calories, sugar, saturated fat, and sodium. So there was an easy point of comparison when making shopping purchases in most major U.S. retailers across the country. Research on that front of pack labeling system has shown that consumers are responding positively and are capable of a greater understanding of that nutrition information as well as more use of that nutrition education or information rather. We are continuing to put forth those messages of Facts Up Front, which is that front of pack labeling system through the website, as well as working through some pretty innovative public-private partnerships. Programs in the U.S. such as Share Our Strength, which is an anti-hunger program, works with low-income families to increase their label usage as well as their cooking skills. In fact, Up Front is part of those programming. We've also worked with the American Heart Association in creating a continuing medical education unit for healthcare professionals that talks about nutrition labeling, so you're giving the frontline staff that type of information so when they talk to their patients and clients. And as we've heard earlier, doctors are getting more involved in this area, so those skills are increasing. The Facts Up Front program has also been a model for other countries working to develop a simple or similar type program. There's been activity in Mexico as well as endorsement in Canada. In addition to the front of pack labeling, Facts Up Front program, GMA is also a founding member of the U.S. Nutrition Labeling Education Consortium, which brings together the U.S. FDA, other members of the food industry, as well as consumer and health NGOs to have discussions and development of consumer education around nutrition labeling. So it's a broader effort looking at not just front of pack, but back of pack as well. The GMA Science and Education Foundation has been supporting the hands-on real-world lessons for middle schools with a focus on food safety thus far. This innovative experiential program, which is integrated with the required curriculums in middle schools, has reached over 60,000 students in 24 states thus far. This program is being expanded to encompass nutritional elements, including food gardens and culinary skills.
Thank you. So, information, business system. Now we have civil society, which is the fourth stakeholder in at least in what we call the Dutch diamond. Harley, Stokes from Food Security Policy Analysis Catholic Review Services.
Good afternoon, I'm Harley Stokes, working in food security at Catholic Relief Services. And we recently had an integrated nutrition conference in Nairobi in 2016. And the theme was how to engage the private sector for greater nutrition impact. And it was really interesting to get some feedback from the participants who said in the beginning they felt like private sector meant working with large multinational companies. And by the end they realized there's actually a lot of other avenues for working with the private sector. So I just want to talk about two that came out of INC. One is, and it's already been mentioned quite a bit, is working with small and medium enterprises. There's an example from CRS Farmer to Farmer program. We work with a woman named Mercy Mwende. She's based in Kenya, and she owns Sweet and Dried. She's the founder of Sweet and Dried. It's a medium-sized company, and it produces dried fruits, vegetables, and fortified flours. And it's based in a rural community. She employs about 20 women and youth, and then she sources locally from farmers. And this is just a great example of how SMEs can help to improve nutrition, especially when you're looking at the agriculture to nutrition pathway. So first, she's providing nutritious food, local nutritious foods that are affordable and accessible. Second, she's providing employment opportunities for women. So 90% of her workforce is female. And she's also providing agricultural income for smallholder farmers. She sources from about 500 farmers. So this is just one example of how SMEs can really help to provide opportunities to impact nutrition. The second thing that came out of the conference was how do we support nutrition-sensitive company policies within the private sector? So examples of that would be making sure maternity leave was 6 months so that women could exclusively breastfeed for that long, or providing clean and private spaces for breast pumping, or child care that provided nutritious meals. So those are just a glimpse of the recommendations that came out of that conference, and I actually have some copies of the report if anyone is interested in looking at some of the other recommendations.
And also for broadening from big and retail enterprise to small scale enterprise, because we are also always struggling with the landscape that is so very diverse. So the this is in line, is Jaina Touré. She's from the Global Alliance Against Malnutrition, and GAIN is also a partner in the food system flagship that Ingrid.
Thank you. So I'll share a little bit about the Marketplace for Nutritious Foods program, which is implemented by GAIN, and an assessment of that we conducted. So in sub-Saharan Africa, the vast majority of enterprises are small, medium in scale, and these provide a sizable share of the foods that are available and accessible in markets. So by providing support to these SMEs, small, medium enterprises, there's the potential for us to improve market food environments, and that's really the premise of the Marketplace program. So the Marketplace provides financial and technical assistance to promising SMEs with the aim of increasing or improving their production of nutritious foods in a way that's inclusive of low-income consumers. And the aim is to improve the availability and affordability of foods in markets. The Marketplace has been doing this since 2012 in Kenya, Rwanda, and Mozambique. So we conducted 2 case study assessments. One, really to understand, looking at our portfolio of businesses, what are the main barriers that they face, and to what extent has the Marketplace been able to alleviate those? What are the best practices for engaging with the private sector? And a second assessment to really look at what are the ways in which we can measure market food environments, because that's a big gap right now. And in doing so, what has the contribution of the Marketplace really been to those market food environments? So I'll share just one example of Tarakbo, which is a dairy cooperative that employs 3,000 smallholder farmers in Eldoret, Kenya. And in their inception, they aggregate smallholder farmer milk and sell it to wholesaler producers raw. And with the support of the Marketplace, Tarakbo had the idea to begin pasteurizing milk and selling it through automated milk retails or milk ATMs. And the idea of those is that consumers can walk into a kiosk with as little as 5 Kenyan shillings and purchase a small amount of fresh pasteurized milk. And that's, at the time, was really against a backdrop of purchasing hocked milk, which was sold raw, or purchasing packaged milk, which is very expensive. So we conducted an assessment of Tarakbo earlier this year, and we conducted consumer surveys, vendor surveys, and market surveys, as well as qualitative assessments in intervention markets where we knew that the milk was available, and in control markets matched to be very similar where we knew that the intervention had not occurred. And what we found across the board was an increase in the production and sale of pasteurized milk by Tarakbo. So they began processing milk and then reducing the share that they sold to large-scale processors and increasing the share that they made available locally. in Ruerd and in peri-urban areas. When we interviewed consumers in intervention and control markets, we found that intervention consumers were more likely to find pasteurized milk to be available to them, affordable, at larger intervals of the day, and quite importantly, over the dry and rainy season. So milk in Kenya tends to be quite unavailable and affordable during those times. So that was a very interesting and encouraging finding. And I'm happy to talk a little bit more about the qualitative side of things in the discussion section, but I just want to leave you with the note that SMEs are shaping market food environments, and there's a potential for us to work with them in order to improve those.
Thank you very much, Diana. Also, thank you for picking the animal-based products, because they are becoming increasingly important, of course, in the dietary diversification. The next one is Erik Trachtenberg from the McLarty Associates, Food and Agriculture Director.
Thank you, everyone. What I wanted to do is I want to go back to a country in change, China. I first went to China in 1992 when they had the foreign exchange certificates, otherwise known as the parallel currency for foreigners. 15 years later, I actually moved to China, and I served there from 2007 to 2010. And when I first arrived back in China, there were a few food safety issues. I was hospitalized 3 times with food poisoning. My son was born in Beijing, so I had to import all my formula through the diplomatic pouch, because that was during the rage of melamine. But also, when you went out to the countryside, you saw low farm incomes because farmers could simply not get their products to domestic and overseas markets. And you saw very heavy losses of fruit and vegetables that were in line with the 40% losses that you see worldwide on the post-harvest side. So one of the issues we focused on when I was in Beijing was the cold chain. And what we did is we put together a public-private partnership. At that time, I was at the US Department of Agriculture, and we got together with the Chinese Ministry of Agriculture, and the China Federation of Logistics and Purchasing, and the Global Cold Chain Alliance, and a lot of different companies. And our goal was to take the Chinese cold chain up another level. Well, thanks to collaboration between many different agencies, we actually managed to convince the Chinese government to add it to their 5-year plan. Yay, victory! Well, that just means we made one small step forward. Let's fast forward to 10 years later, 2017. I recently conducted an assessment of China's cold chain standards and regulations. I have a report available in agonizing detail if anyone should be masochistic enough to want to read it. Anyway, so what had happened in the intervening last 10 years? There was a dramatic increase in retail. For example, I took a trip to Xi'an, which is a city in western China. At that point, retail was growing at 40% a year. Now, obviously, it's from a small base. We all know our statistics. Can't go 40% forever. Cold storage increased dramatically, and you saw an influx of foreign investment from entities such as the Swire Group and from Goldman Sachs. So jumping forward really quickly, so what do we have in terms of cold chain standards today? China is very heterogeneous. You have levels of development which include areas that are equivalent to Guatemala and others that are equivalent to Spain. Very difficult to regulate. The quality of cold chain varies from good to, well, not very good. So what has happened in the Chinese context is that companies have actually taken the lead in regulation. You think it's a very top-down society, but in terms of setting cold chain standards, companies are working with the government to set standards. And this process has actually been driven by consumers, which are also being driven by change in restaurants and in retail. Industry is actually leading the way. But still in rural areas, we have, in words of one of my Chinese interlocutors, high prices and bad food. And then sometimes fake food. So what does this mean for the future? Chinese government's investing heavily in subsidies. They put $300 million into it so far. There is a lack. They need to increase capacity. Investors are going in. They're crafting new standards. But companies still need to have strong control over their supply chain and surveillance. But consumer awareness needs to step up. And the question is, of course, going back to the farmer, we need to face the issue of the first and last mile. So as I said, the report's available, but this is just a teaser, and thank you very much.
Thank you. I think we will discuss what we can learn from China, because that is really a very particular country in terms of organization, scale, and policies. The last one is the contribution from Wageningen, he is from Harvest Plus and also part of the program.
Thank you, yes. Hello, my name is Benjamin. I'm with Harvest Plus, and we are a part of the IFPRI program. Harvest Plus breeds micronutrients like vitamin A, iron, and zinc into everyday staple crops like wheat, rice, and maize. Let the plants do the work of delivering nutrition, and biofortification is our breakthrough innovation. As everyone in this room knows, the hardest part is not creating the nutritious food. The hard part is getting that nutritious food to the base of the pyramid, as was already referred to earlier. Now, those of you with eagle eyes might have noticed in Nellie's presentation a very small logo of Harvest Plus there. Now, that was Harvest Plus providing seeds to those 11 farmer cooperatives who then provided it into that company that was creating that food. Now, that's institutional demand that helped drive farmer adoption of biofortified seeds. What I'm going to very, very, very briefly talk with you about is how we create consumer demand and use that to drive farmer adoption of biofortified seeds and consumption of biofortified foods. So Harvest Plus has partnered with Farm Fresh, a Rwanda-based project of H2O Venture Partners, which is a UK-based venture capital firm, to create cooked iron bean products made with biofortified high iron beans. Biofortified beans are sourced directly from rural farmers to be used in Farm Fresh high iron beans premium quality cooked bean product. This product line is targeted at consumers whose purchases are driven by both convenience and nutrition, and there's been an extensive marketing campaign targeting those Rwandan consumers. Harvest Plus provided Farm Fresh with supply chain linkages and guidance on food processing, branding, labeling for biofortified products, and packaging. The product's available in 30 supermarkets today, which will expand the retail market for biofortified beans to new businesses and consumers. Farm Fresh actually pays a price premium for those high iron beans, and that additional margin drives rural farmers to produce greater quantities of high iron beans. And we've recently done an impact assessment in Rwanda that confirms that farmers are willing to grow higher iron beans, and that adopters increase the proportion of their bean growing land area to high iron bean varieties over time. Iron beans constituted up to 12% of national bean output among smallholder bean farmers in Rwanda, and growers used up to 80% of their own high iron bean harvests for home consumption. Very quickly, Farm Fresh plans to export pre-cooked beans products, these same products, to neighboring markets including Democratic Republic of the Congo, Uganda, and Kenya. These products cost 1,500 Rwandan francs each, and these iron bean packs are 200 francs pricier than mixed beans, but outsell the latter 2-to-1. I'll be able to talk more about the importance of consumer demand in driving the nutrition agenda.